Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Minister of Interior Rauf Aregbesola says correctional centers in the country have been kept free of the spread of COVID-19. More states flag off vaccination campaigns, increase centers across local government areas. South African government says vaccines are effective against Omicron as most sick people are unvaccinated. Thank you for joining us. Cases in Nigeria shot up to over 700 of COVID-19 in a single day after weeks of lower cases, suggesting a fourth wave of the pandemic. Lagos State alone registered 595 cases, according to the Nigeria Center for Disease Control, set to be reported for December 8th and 9th. 10 other states and the Federal Capital Territory also recorded cases totaling 754 and 1 death. The NCDC says a multi-sectoral National Emergency Operations Center is activated at Level 2 that continues to coordinate the national response activities. Here's more on the latest figures on the update.
754 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 11 states and the FCT, indicating a significant increase from the figures reported earlier. Lagos had the highest infections by far with 595 cases, followed by the FCT with 68. Imo had 49 cases, while Edo registered 13 cases. Other states include Oyo and Delta with 9 and 5 cases. 4 cases were logged in Katsina, while Kano and Plateau had 3 cases each. Ekiti and Gombe had 2 cases each, while Rivers had 1 case. The new tally has increased the total confirmed cases in Nigeria to 215,918. No cases were reported from Ondo, Ogun, Osun and Sokoto states. 99 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,619. There was 1 additional death resulting from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,981. Currently, there are over 4,000 active cases in Nigeria, while over 3.6 million samples have been tested so far. Global vaccinations have topped 8 billion doses, while more than 7.4 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, and over 3.8 million persons have been fully vaccinated. In Africa, there are more than 8.8 million confirmed cases and over 224,000 deaths reported across countries on the continent. The total global confirmed cases have surpassed 268 million, while deaths are beyond 5.2 million.
Nigeria has been described as one of the few countries in the world yet to witness the outbreak of COVID-19 in all the correctional centers in the country due to the diligence of its officers and proactiveness. The Minister of Interior, Mr. Rauf Aregbesola, announced this at the Interior Ministerial Strategy Retreat in Ilorin, reacting to the Bauchi Correctional Center, where 4 armed robbery suspects were discovered to be COVID-19 positive when brought in. He says they were quarantined and treated, found to be negative before they were incarcerated.
Nigeria stands among the few nations of the world that have not experienced COVID virus infection, coronavirus infection in their custodial centers, as well as transmission. For those who want to challenge this by making reference to Bauchi, where some 4 armed robbery suspects were brought in already infected, were kept in the quarantine within the service and treated here until they became negative. So outside that, which, if you want to put it correctly, was an importation.
Over in Enugu State, government has launched the Basic Healthcare Provision Fund and also commenced the mass COVID-19 vaccination exercise with plans to inoculate at least 50% of its adult population. During the flag-off, the State Deputy Governor of Enugu, Mrs. Cecilia Ezilo, noted that the state is not only opening up more centres, but has approved for mobile centres across all the wards. Residents have been encouraged to take advantage of the period and get vaccinated for their health and safety.
Abakpa Health Center is the venue for the launch of the Basic Healthcare Provision Fund and massive COVID-19 vaccination exercise in the state. The Deputy Governor, Cecilia Ezilo, residents of this area, health workers, staff of the Enugu Primary Healthcare Development Agency, as well as development partners, are here present for the flag-off. The target for this month-long campaign is at least 50% of the adult population, and the state says it is optimistic of success, while the WHO representative assures all present of vaccine safety.
And now we've started in this third phase, and so far we have over 139,000 and still counting.
I am vaccinated. I've taken my first dose, I've taken my second dose, and I'm waiting for my booster, which I'm supposed to take 6 months after my second dose. This has now been approved by the government of Nigeria. So everybody present here, please take these vaccines. These vaccines are safe. These vaccines are effective. And these vaccines will do what they are expected to do.
Vaccination sites have been multiplied throughout the state.
It has also created vaccination sites in all secondary and tertiary health care facilities. In addition to 24 mass vaccination centers, 36 mobile vaccination vans, and designated some selected private health care facilities as vaccination centers.
The massive vaccination kicks off immediately with residents getting their jabs at the venue. Come January the 5th, 2022, a minimum of 1.2 million persons in Enugu State should have received at least one jab, a move the government believes will keep the Omicron virus at bay.
I will now present his card to him.
Staying with the vaccination expansion, the Kaduna State government has flagged off another phase of COVID-19 vaccination as part of measures to contain the spread of the virus and the new variant. Although no case of the Omicron variant has been recorded in the state, the state's deputy governor, Dr. Hadiza Balarabe, who flagged off the campaign in Kaduna North local government area, explains that the mass vaccination against the virus remains the most effective public health measure against the pandemic. She says that about 3,588 personnel in both the public and private sectors in over 300 sites will be engaged in various capacities to support the mobilization.
The Kaduna State government is flagging off another phase of vaccinations in Kaduna North local government area in an effort to curtail the spread of COVID-19.
Get these vaccines free from every public hospital and a few designated private hospitals. They don't have to pay anything for it, and they should make sure also that their friends and their relatives all take the vaccination.
As a way of showing leadership, the Kaduna State Deputy Governor, who is also a medical doctor, administers vaccines to some residents who show up for the vaccination exercise. According to her, the target is to have persons 18 years and above vaccinated with the hope of vaccinating at least 70% of the residents by the second quarter of 2022.
We all have a task to let our people know. For those of us that are here, it is our responsibility to take this information back to our neighbors, our brothers, our sisters, and everybody within our immediate environment.
While the response to COVID-19 infection is still faced with several challenges, Kaduna State Deputy Governor says the major challenge remains the Herculean task to deal with the misconception that the pandemic does not exist.
As a people, we were lax in our observance of the protocols. And so this is the time for us to reactivate that, should I say, that mechanism in us to help us to be a bit more compliant.
As the world faces another variant of the pandemic known as Omicron, experts say the surest way out of it is to get vaccinated and keep observing the safety protocols of hand washing, maintaining physical distance, and keeping away from crowds.
The World Health Organization says that studies show that cases caused by the COVID-19 Omicron variant appear to be less severe, with hospitalization rates lower than the Delta variant. And there are also news that says that Omicron is affecting children more than any other age group. Well, joining us to talk more about this in the studio is Dr. Patricia Akinto, a consultant pediatrician, Pediatric Infectious Diseases Unit, the Lagos University Teaching Hospital, Luth. Many thanks for joining us on the program.
Thank you. Good evening.
Good evening. But I'd first like to begin with your thoughts about the pandemic since it started, and especially where we are now. And this is also, as we just saw, over 700 cases recorded last night in Nigeria.
The pandemic has actually never left, and we are now out of the woods, and it's coming back stronger than it was because we're seeing rising cases in recent times. So we are in the fourth wave.
So looking at Omicron, do you think it complicates things?
It's the variants of COVID-19. We have various variants. The problem about Omicron is that it spreads very fast, and the symptoms are not typical like the other variants, so it's likely to be missed, especially in children where you see them having stuffy nose, runny nose, sneezing, they have a sore throat, and they have a headache. So we'll probably think it's a common cold. That's where the problem lies.
So we saw that countries, take South Africa, for example, recently some children had gone to hospital for various other reasons. One was malaria, another jaundice, a third even a broken bone, and then they all did a COVID test and they were positive. Are we seeing any of that here? And if you look at the data since the pandemic began, in terms of the children in Nigeria, is there like an increase in terms of those coming down with COVID? And do we know anyone that has perhaps gotten Omicron variant or recorded any?
For children in Nigeria, they've had COVID. But you know those centers, those countries you're talking about, they do a lot of massive testing. We are not even testing enough. So we have children with COVID. But for you to say it's Omicron, you have to do some sequencing and type the organism, which we haven't done. And I suspect we may already have Omicron in Nigeria, even amongst children, but just that we haven't really typed them among children.
What are the expectations? Take, for example, Lagos State in terms of testing.
We need to increase our testing. Everybody needs to, if you have a symptom, go and test, and that's the only way we'll pick those who are infected. The children do very well with viral infections. The COVID is not a major problem for them, but then it's a problem for the adults who move around the children. So children are playing, they have COVID, they play around, and the adult now falls sick. So if it gets to the children, it will get to the adults.
Apart from that, we're also seeing the federal government say, okay, now time for booster shots. It's happening in other countries. We're seeing breaking news that booster shots give you better chances against Omicron. The Africa CDC is saying just the vulnerable should take the booster shots because we don't have enough for everyone on the continent. But for children, we haven't started talking about vaccinating children in Nigeria. Should that be something that should be on the table now?
Definitely should be. We should think about vaccinating children, but the truth is we've not vaccinated the adults enough. Even those most of those that are exposed or are working in high-risk areas, they haven't been vaccinated. The government is trying to give us a booster dose. So, but we should think about vaccinating children, because once you keep a group of persons that are vulnerable, the children are, and get infected, they keep spreading these things to other people. So we should think about children. But the issue is that the vaccine is not even enough globally. So we need to prioritize who you give what to at a particular time. Because for them, children, why we are not giving children now so much is because it's not a major issue for them. It's more for the adults.
So moving forward, and this is also as we try to stem this fourth wave, what's your advice?
Everyone should be at alert. We are not out of the woods. So all our protective measures we should keep on. People don't wear face masks anymore. They just go about as if it doesn't exist. It does. Even children, encourage them to wear their face mask when they are in school. And because if you don't go out as an adult, your child goes to school, brings it home to you, you get it. And that's the best way we can do. Let's just keep doing what we were doing before, and we'll be good.
We'd like to thank you. We appreciate your time on the program. Dr. Patricia Akinto, consultant pediatrician and pediatric infectious disease unit with LUTH. Thank you for joining us on the program.
Thank you for having me.
As South Africa grapples with managing a surge in COVID infections, the health department has given the go-ahead for 12 to 17-year-olds to receive their second dose of the Pfizer vaccine. This has to be 6 months after the first was taken. Also approving for adults who have been fully Pfizer vaccinated to receive a booster shot. Briefing the nation today, Health Minister Dr. Joe Fala says vaccines remain the best line of defense, even against the Omicron variant, which seems more transmissible, but with less severe sickness.
Our scientists are also still conducting more studies to understand the potential impacts of this variant in as far as how it behaves towards the vaccination. And this will also take some time. But current vaccines have shown to be effective, even as this wave has been spreading, because the significant number of almost, in many reports we have received, suggests that 70% of those who have been admitted to hospital are those who are unvaccinated. So as things stand, the vaccines are showing to be really still very strong in protecting against severe disease. As it has been with the previous variants, it shows what the figures from the numbers from hospitals does show that indeed those who are vaccinated are much better protected even against this. So there are some indications that some of this, there might be some weaknesses in as far as some of the vaccines. Some of the reports indicated there might be some weaknesses on the Pfizer, but again, this is very early. But overall, what we are seeing is that the protection is still very strong, even on this variant, as I've said. At least those who have been admitted to hospital, it shows up to 70% being those who have not been vaccinated. The PCR tests are still very effective. Also in terms of the rapid antigen test, also shown to be very effective in picking up this variant as well. Current treatments are also still very relevant: steroids, corticosteroids, oxygen therapy, antivirals, anticoagulants, all this which have been used over the last 20 months or more have shown to be very effective. The issue of infection of children, let me just touch on that. During the 3-week period from 14 November to 4 December, there has been an increase in admission of children under 5 years. This has been observed in the Tshwane Metro hospitals, where the early resurgence has occurred. Children 18 years and younger comprised 21% of admissions during the early period. However, this pattern has changed over the time, over the subsequent time from the early days, and the proportion of admissions in children less than 5 years in total admissions has decreased.
And away from South Africa, a total of 69,601 new infections were reported. An additional 527 people died in the past 24 hours, according to the Robert Koch Institute, RKI, the National Disease and Control Center for Germany. This marked the highest COVID-19 daily death toll since February 18, when there were 534 fatalities. Germany's 7-day incidence rate dropped significantly but remains high at 420 27 per 100,000 inhabitants. The country has recorded over 100,000 deaths from COVID-19 in total since the outbreak of the pandemic. Well, joining us to talk more about the situation in Germany is Deutsche Welle correspondent Chelsea Dulani. She joins us from Berlin. Hi, Chelsea. With all that's going on, can we say that the fourth wave has been broken?
Well, I'd say it's much too early to be making any declarations about this fourth wave. We have this week seen the infection rate slowing down. Now we're seeing about 414 infections per 100,000 residents. That is compared to a rate of about 442 a week ago. But many health officials are worried that this could actually be a case of underreporting of cases because the healthcare system and labs are so overwhelmed right now. So it is possible that there are more cases that just aren't being registered by the government. Germany has introduced tighter restrictions, particularly on the unvaccinated who now are barred from places like restaurants or non-essential retail stores. And that is expected to help by reducing contact with people who aren't vaccinated and who are playing a key role in spreading the virus now. But you also now have the Omicron variant spreading here in Germany and throughout the world. And given what the early research has shown, specifically that it could be 4 times as spreadable as the Delta variant, then that definitely raises the risk that these contact restrictions will be negated by the new variant.
But Germany now has a new government and a new health minister. Tell us more about this new minister and what this means for Germany's COVID strategy.
We do indeed. His name is Karl Lauterbach, and he assumed the role of Germany's new health minister this week as we got a new government put in place. The first thing to know about him is that he's actually a bit of a celebrity here in Germany. He's been a very prominent voice throughout the pandemic on social media, on television. He's a Harvard-trained epidemiologist, and throughout the pandemic, he has been really an advocate of tougher restrictions to prevent the spread of the coronavirus. But he's also a bit quirky. He's known, for example, for always wearing bow ties. In any case, what this does mean for Germany is that they're now going to have an expert in charge of pandemic response. And what he has said is that fighting the pandemic should be the main goal for this new government. Given what we know about his cautious approach in the past, I think we can expect more of the same from the new health minister now.
Also, Chelsea, perhaps the biggest challenge for the new health minister, celebrity minister, is to convince vaccine skeptics. Does he have a plan?
So he hasn't put forward one yet, but we can, of course, take some clues from his past positions here. In recent months, as the vaccine campaign has lagged, he has pushed for unvaccinated people to be restricted from many parts of public life. For example, in mid-November, he did push for people who haven't been vaccinated to only be allowed into supermarkets or pharmacies, and that is something that now actually has been implemented across Germany. He's also been very vocal about how dangerous it is for people to be unvaccinated, so getting that message about the risks across has been a priority. And this morning, actually, he also voiced support for implementing fines for people who don't get vaccinated and said that such financial penalties will be unavoidable. Still, just under 70% of the population is vaccinated here in Germany compared to levels of around 87% in Portugal. So there still is a very long way to go. But since taking over his position, he's also been very clear about how getting people booster shots is also going to be a big priority for this new government, especially given that recent evidence showing 3 shots instead of 2 are needed to really be protected against the new Omicron variant. So in addition to these stricter rules for unvaccinated, potentially penalties for them, he also will be focused on building up further the vaccine infrastructure here in Germany. And he's already announced that he will be looking into our vaccine supply to make sure we have enough to meet the government's goal of vaccinating 30 million people by the end of the year, as well as securing future supply, because these variants have shown us that more shots are going to be necessary as the virus continues to mutate and protection from vaccination fades.
We'd like to thank you. Chelsea Dulani there, reporting from Berlin, Deutsche Welle correspondent. Well, news just in says that 2 doses of a COVID vaccine are not enough to stop you catching the Omicron variant, and this is coming from UK scientists. Early analysis of UK Omicron and Delta cases show the vaccines were less effective at stopping the new variant, but they're reporting that a 3rd booster dose significantly increased protection to around 75%. Here's more on the global update.
Australian Prime Minister Scott Morrison says the country will begin administering vaccines for children aged 5 to 11 from January the 10th, 2022.
And now we have taken the decision, based on the best possible medical advice through the TGA, that we'll be extending that vaccination program to 5 to 11-year-olds and giving parents the choice. As a parent, there are no more important decisions that you make than those you make about the health and well-being of your children. And we want to make sure that we have been one of the first countries in North America, in the United States and Canada, having observed their experience and looked at their results to be able to move to vaccinations for 5 to 11-year-olds.
South Korea says it'll further cut the interval for coronavirus booster vaccines for all adults from 4 to 5 months to 3, as it struggles to fight record levels of infections amidst concerns over the Omicron variant. The move came 3 weeks after the government reduced the booster gap for people aged 60 and older and primary groups to 4 months from 6. South Korea has fully vaccinated almost 94% of its adults so far, and more than 31% of some 17 million eligible for a booster shot have received it. Across France, pharmacies say they are facing a shortage of COVID tests as cases rise. Official data shows nearly 5.3 million PCR and antigenic tests were carried out from November 29 to December the 5th, the highest number in months, and a 31% increase on the previous week, which itself was about 38% higher than the week before.
You can visit our website for more updates and a better understanding of the pandemic. You can find breaking stories as well as other news at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.